What are the brace options for children with scoliosis? Scoliosis is most commonly diagnosed in children, mostly among school-age children, and the most common diagnosis is something called adolescent idiopathic scoliosis, which is normally diagnosed between 10 and 18 years of age. And it's one of the most common spinal conditions related with school children. Now, the most common symptom associated with adolescent idiopathic scoliosis is normally a postural deviation due to the unnatural forces that get introduced into the body. The body's overall symmetry is disrupted, and the most common thing we tend to see is uneven shoulders. We tend to see hips that are out of alignment. We see some rib arching or rib deformity starts to occur, especially when the patient begins to bend forward. We see uneven waistline. We see arm and legs that tend to appear to hang at different lengths and also different distances from the body. So when we look at treatment for adolescent idiopathic scoliosis, what does it really involve? Well, there's two main treatment approaches, and the first one being something called traditional treatment options, and the other being more conservative, or I like to call also corrective treatment options. Traditional treatment options for adolescent idiopathic scoliosis is typically watching and waiting when we see small curves or mild curvatures. As curves progress and the patients are still growing, they may involve traditional bracing, typically something called the Boston brace or something called a Providence brace, which we'll explain in a second. And then if the curve continues to worsen, then it funnels patients towards surgery or spinal fusion, where they're using rods and screws into the spine and implanting these rods and fuse and using bone grafts to make the spine straighter. So they're sacrificing movement and function for alignment. Conservative treatment options or functional treatment options really involves a proactive treatment approach that are trying to treat the spine as soon as the curve is diagnosed to reduce the curve and prevent or try to counteract the natural progression that the curve tends to have during growth. So conservative treatment options tend to integrate multiple condition-specific treatment disciplines for the best possible results, meaning most doctors, especially at Scoliosis Reduction Center, we're not just relying on one type of treatment, meaning we're not just doing exercises, we're not just doing bracing, not just doing therapy, we're not just doing home care, we're not just doing chiropractic care, we're doing all those things, and we're integrating them in a way to make a very big impact on the progressive nature of scoliosis. There's a very, very big difference between traditional bracing versus corrective bracing. Traditional bracing is the most common brace used in the United States, and the most common brace by far is something called a Boston brace. A Boston brace was designed in the 70s, and really the design hasn't really changed too much over the years. The only thing that's changed is kind of how they manufacture the bracing. They're not using plaster casting anymore, where they actually plaster cast the patient, take the plaster casting off, and then they mold out of a plaster cast. They're more likely using scans, and they're scanning the patient and building the brace off of this. But the design is pretty much been the same. And the goal of these braces are really just trying to slow down progression. The goal of these braces are not to reduce the curve, correct the spine, improve body symmetry, improve posture, and they work via a 3-point pressure system, meaning they have 2 counters and 1 push. And they're normally squeezing from the sides. And it's this squeezing effect that creates some negative things that we don't want to see in bracing. And one thing, it can weaken spinal muscles and tissues over time, and it can also increase postural deviations. In particularly, it can affect the rib arching in a negative way, because if you have a rib arch that's bending back like this and you're squeezed from the sides, you can increase the rib deformity. And this is because it's only addressing the spine as a 2-dimensional problem. And it's really ignoring the rotational component as a result of the scoliosis. And in addition, since it's only addressing the spine in a squeezing effect, it can affect the sagittal alignment or the side curvatures in a negative way, especially in the lumbar curve, because the way the brace is designed, it's designed to actually reduce normal lumbar lordosis. So even if it's effective at controlling the scoliosis during growth, growth, it's reducing the normal lumbar lordosis, which predisposes patients in the adult form to have more pain. And now if the patient has more pain as a result of reducing the lumbar lordosis as a result of their Boston brace, it can cause more problems and complications as they get older. It tends to become less comfortable as the patient wears it, and it's bulkier than most braces that are designed in a corrective manner. And because of it being uncomfortable and being bulky, there's a lot of compliance issues. The difference in a corrective or conservative brace is those exact words, is that conservative braces are corrective in manner. And there are many different types of corrective braces. And one type that I use is something called a Scoli brace. And a Scoli brace is more of a modern brace concept that represents really a culmination of all the things that we've learned about bracing and scoliosis over the years. It's like looking at cell phones, like a cell phone today compared to a cell phone 20 years ago. They're not the same. Why? Because cell phones have evolved because they've learned and they've applied new technology. And that's the same thing that we've done with these braces. And when it comes to putting on a brace, is that we're addressing many of the shortcomings associated with traditional bracing. And the goal is not just trying to slow down progression, but the goal is trying to reduce the magnitude of the scoliosis. And we do this by pushing the spine into a corrective three-dimensional manner, meaning we're not just working on a three-point pressure system, we are three-dimensionally trying to reduce the curve in every aspect, in the rotational components, in sagittal components, and in lateral bending components. And since we're addressing the three-dimensional nature, this tends to have a corrective result towards the patient. And since normally the brace is actually reducing the size of curve, the brace becomes easier to wear with time because the body's actually becoming better. Kind of like braces on your teeth. When you wear braces on your teeth, the first few days are very, very difficult, but as your teeth begin to move, the braces on your teeth become easier to wear because the teeth are becoming straighter. And it's the same thing too with these corrective braces. Now, one thing to understand when it comes to corrective bracing is even though the name of a brace may exist, like whatever it is, the key to bracing is the design and the fitting and the management of the person wearing the brace. So first of all, designing the brace to be very corrective in nature, and designing it in coordination with everything else the doctor was going to do, which we'll discuss in a second. Secondarily will be the fitting. Fitting of braces is just as important because normally most braces need to be fitted on site to make sure they're delivering the most corrective nature. Meaning a good design gives us a good start place, but you must fit the brace to the patient to get the very maximum amount of reduction that could occur in that initial brace design. And then thirdly is the management. Managing a scoliosis brace, meaning most conservative braces need to be managed appropriately. And let me explain what I mean by that. Traditional braces are typically not managed. They normally give them a brace. If the curve worsens, keep wearing the brace. If the curve gets better, keep wearing the brace. Nothing is done to manage this brace over time. However, in Scoliosis Reduction Center, we manage scoliosis braces very similar to orthodontists manage braces on your teeth, meaning as their teeth become straighter, they modify the braces on the teeth to continue to make them straighter. We do the same thing. As we put on a brace and we see spines tend to improve, we're just not happy there. We're modifying these braces and making them more aggressive over time to continue to reduce the curve. As the curve gets better, we want to be more aggressive to make the curve get even better. And then lastly, to make these braces work well, we know scoliosis braces alone can have limited effects. So therefore, no brace on its own, I believe, can deliver the maximum results in a patient. I see clear differences when patients only receive a brace versus when a patient receives the right type of scoliosis treatment that complements their brace. And this is something that we call scoliosis therapy or rehabilitation. This scoliosis rehabilitation is very different than traditional rehab or traditional injury treatment. And it's not just doing things to help increase strength of the body. It is something helping improve flexibility, including biomechanics. It's helping improve flexibility of where the scoliosis curvatures exist. It's home therapy. It's self-corrective exercises. And it's a combination of all these therapies with a very strong corrective brace. These things complement each other. One accelerates the other and allows us to get the very best reduction in patients with scoliosis. So corrective bracing is a very important component for scoliosis treatment in adolescent cases. But it's not just limited to that. There's many adjunct treatments that we use to help improve the results. So here at Scoliosis Reduction Center, we offer conservative treatment options for children with scoliosis. And a good scoliosis brace is, of course, my brace of choice to try to get the most corrective results in a patient in combination with therapy and rehabilitation prescribed for that patient unique curve type. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.